Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece.
Hi friends, stay curious, stay informed, and keep learning. Please like, share, and subscribe. And in today's video, we have chapter 52. In this unit about the skeleton and muscle functions, we first in the unit it's assessment. And chapter 52, assessment of musculoskeletal function from medical surgical Davis Advantage. It's nursing textbook. So this chapter covers the anatomy and physiology of the musculoskeletal systems like bones, muscle, joints, ligaments, tendons, and fascia. Assessment procedures like history, physical assessment, posture, gait, joint mobility, sensation, pulse, muscle tone, and strength. Also, this chapter talks about diagnostic studies like laboratory studies and imaging procedures like X-ray, CT, scan, MRI, arthrogram, DEXA, bone scan, MAG, arthroscopy, and arthrocentesis. Each chapter talk has a section about age-related changes, especially it's very important. This chapter about age-related changes in musculoskeletal function. So I hope you like this little image. Gemini made it for me. So we are in NCLEX part 3 section. So the NCLEX it's broken in, as you see, in I call it 15 domains, and these specific areas is not just by knowing your context, it's about knowing how to apply in different situation. And this chapter we talk about the musculoskeletal function. It's assessment, so it's not too deep into a disease specifically. It's more a little bit anatomy, pathophysiology, and laboratory studies to kind of an overview on next 2 more chapters that this unit has. And let me put this picture as well, and I want to say that those domain here is like somebody that had this unfortunate to do not pass and claim that was below on basic care and comfort. So every video about NCLEX I'm gonna have these because this is an example that we all learn from mistakes and that we raise above because we learn from others. And this person was very nice to let us know what we can focus more. So since basic care, like here in this pie, NCLEX's basic care and comfort is 6 to 12%. So a question can have like 3 basically on select all or apply. can have like one or two or even three about basic care and comfort. And basically you if you don't, like if a candidate doesn't select, let's say a question has two, basic care or comfort, and now this candidate says no, I think it's one of the basic care and comfort, and then so that means it's -1, right? And then because the question had two, then moving forward, let's say has pharmacology and again basic care and comfort, and then these candidate maybe do like pharmacology good and maybe not selecting the basic care, and then that's why NCLEX might give you a below. So in this video I will explain and give example like one or two, not more, but in this booklet has one page, like probably like 27 scenarios, examples that you can make on your own. It's give you like a little topic and then you just think about, and I will make from each pie just one or two that I thought like might be relevant to this chapter. So like one of two of these, one or two of these, same like here, one of two examples from here, just one or two. I try to keep it short, but lately I just realized my videos become too long and maybe I bore people, which I don't want that. Let's see. Let's go back to basic care and comfort. And we see pharmacological, it's huge. Management of care, it's huge. Yeah, management of care should always be huge because as an RN, you need to you do this leadership. This is kind of leadership. Um, so let's say, so as I said, this chapter usually I make about between 10-15 just because of this 10-15, but today I focus more on this area because it's assessment and this on top, and at the end the 16, because I have 16 today, the last one will be a selector of the apply where I have basic care and something else, and you'll see like how exactly a hypothetically question that a candidate might see in NCLEX. So it's hypothetical. Um, so just keep in mind that recognizing the cues here, recognize the cues. It's like imagine when you review for NCLEX and you think about musculoskeletal function, or when you review pediatrics or mental health or musculoskeletal function like today. Think what clinical manifestation are observed in this patient. Analyzing the cues, it's like how do the clinical manifestation correlate to the underlying pathophysiology. Prioritizing hypothesis, what could happen if these patient symptoms are not effectively managed. Generating solution, what treatments are involved to manage this patient condition. Taking actions, like what are the priority intervention for this patient. And lastly, evaluate outcome. It's again a question, what findings demonstrate that the treatment plan is effective? What follow-up data are needed? So to look more in depth, just go below and download these, or just go to the National Council of State of Board of Nursing, and you can see this um, how you say, kind of study guide, I call it, and you have an idea. So the more question you do, the more you question yourself and you make your own case studies. I think that you need to do in your own mind um, to pass this exam, and you need to use like around a full-time job. Basically it's like 8 hours a day, but you can do a break 4 hours and 4 hours, like you wake up early in the morning and you start doing, and then later in the afternoon you can do again. So even if you go at your work, and especially that's how you say, in California, every nursing school recommends, and the entrance into those programs is to have either volunteer work in healthcare, or to have any work related to it, or you are a caregiver or a CNA, certified nurse assistant, and you do it for a long time. For me, this I started being a certified nurse assistant. I was for 5 years in skilled nurse facility, so I learned a lot in SNF. We call it a SNF. Um, because you'll see how the nurse will do, and as a certified nurse assistant, you see, even if you do the basic care, we go back to basic care, you do the care for the patient, you see if it decrease or improve. So that basically it's your critical thinking for future nursing, critical thinking, and then you evaluate. Oh, today you are better. Oh, today you did this. Oh, today you were not able. You have stiff joints, and then you need to report why it's stiff joints. So on and on. I better move forward. Okay, let's go to the next slide. Here, I'm looking for my pen light. You see NCLEX domains, definitions, what those means. You see, basic care and comfort provides comfort and assistance in the performance of activity of daily living. It's the ADLs. So, red flag traps, priorities. So when I do for NCLEX, it's good to see the red flags and what a nurse should do, and what I should be aware to do and not to do. So here it says like do not ignore. You see, do not ignore, do not ignore, do not ignore. So basically it's like the fall risk, decreased mobility, always clarify and clear imaging orders. So now we go to the next slide. Here also is the definitions, and here is like copy and paste because they are related to each other. Here is like safety and infection control, what to watch for in the NCLEX: fall risk, fracture, precaution, infection with open fracture, post-op infection signs. Because it's very important, like fall risk. Why? In this chapter we talk about the assessment of musculoskeletal. So most of them, they are repetitive, and fall risk, it's the priority. So high yield topics, what to watch for safety and infection control is fall risk, fracture, precaution, infection with open fracture, post-op infection signs. What the question asks you to do is recognize the high fall risk patient. So you need, in the case scenario, to make sure which patient is at a fall risk. Intervene for infection prevention. And classic pitfalls to avoid in a question: overlooking skin breakdown, not assessing surgical site for infection. Then for health promotion and maintenance, what the NCLEX ask you to watch for: calcium, vitamin D intake, weight bearing, exercise, smoking cessation for bone health. Because we are in assessment of musculoskeletal, so it's about skeletal here. So calcium and vitamin D is very important. Educate what the item asks you to do. So educate about lifestyle choices that prevent osteoporosis and support musculoskeletal health. A classic pitfall to avoid here is ignoring patient age and comorbidities when recommending exercise. Psychosocial integrity, it's always body image. So make sure with deformities or immobility, pain interference with ADLs. What the item asks you to do: assess coping mechanism, provide support referral for altered body image. Classic pitfall: focusing only on physical status and ignoring the emotional needs is very important. Like if somebody has a body image, then automatically also might have some anxiety about it or depression about it. So that's why focusing on only on physic than emotional, because you taking care, a nurse taking care of a patient, not just on numbers, like how the data came from the lab and let's do a Foley catheter. Oh, let's do, we know how to make these IV tubes, how we put IVs and all kind of things, but you ignore the emotional state. So that is very important. And always a nurse need to ask a patient if tolerates well, and always even has consent to continue the next step. You need to same ask, it is okay to move forward. But before you, of course, you teach what you're gonna do about it, and says yes, but might not know what means yes, like you say, oh, I'm gonna do this, and then says yes, yes, sure, and then while you start to kind of get the face like surprise, oh my god, are you doing this? So you have to say, are you okay, we're moving this, we're doing this. Just always talk to the patient, and that gives them comfort. Management of care, interdisciplinary care, PTOT, always we have PTOT. The dietitian for nutrition, discharge planning with assisted devices. When they get admitted in hospital, you talk also about discharge planning at the same time. Coordinate referrals, of course, again, referral. Then classic pitfall to avoid on management of care is to delay consult discharging without needed home modifications. My throat hurts. Basic care and comfort. It's assisting with mobility, splits, cask, pain, positioning. This you need to watch for. Items they ask you implement comfort measure and support mobility safety. Classic pitfall to avoid neglecting repositioning or pain cues. So pain is a vital signs, and always you do when you before you give a medication, ask, and any pain, but can be physical pain, but also emotional pain, and evaluate. Pharmacological and parental therapies, the NSAIDs. Here it's the bisphosphonate. Be careful when you give this. You need to know what time of the day, when you give it, for how long. Opioids, give constipation, right? Muscle relaxants. Assess for side effects, monitor labs like calcium renal. Educate on timing and purpose. Classic pitfalls to avoid missing renal consideration in elderly, giving NSAIDs without GI protection. Yeah, because make sure when you give in NSAIDs, GI. Reduction of risk potential complication of mobility, DVT, skin breakdown, post-op, neurovascular checks. Items to do, be careful with 5 P's, cleft pain, pressure ulcers, classic pitfall in ignoring subtle signs of compartment syndrome of DVT is very important, especially for post-op and people that stays a very long time in bed. Make sure, and it's also related to fall risk and weight bearing, so they're all like a domino here, and they correlate to each other. Psychosocial adaptation is surgical repair, cast care, and then fracture recovery. So what you need to do: monitor healing, teach about cast care, reinforce post-op precaution. Then classic pitfall, using limp without checking weight bearing status, missing signs of non-union. So now we start doing questions, and as I said, I have 16, and then I have from basic care, a few of them, management. I have more on this. Safety I have. So I will make a question, and I will explain that this is the domain, and then we give the hypothetical question and the answer with rational. So now we start the questions. Question 1, domain, safety and infection control. A nurse is caring for older adult patient with osteoporosis who is a high risk for fracture. What is the nurse priority action? encourage increased dairy intake, assess home environment for fall hazards, monitor for signs of infection, provide passive range of motion. And I hope you know that I have like in each questions, actually they are from my example that I just said a while ago. Every time in each video when I explain the pitfalls and things to avoid about NCLEX, actually I have them in my questions. So it's easy to know. So my correct answer is assess home environment for fall hazard. We've been talking about fall precaution and at home environment when they discharge, right? Because we talk about high risk for fracture. So what is the priority? So safety and infection control. And fall precaution is a priority in patients with osteoporosis to reduce the risk of fracture. Assessing and modifying the home environment directly prevents injury. Next question. Question 2. Domain health promotion and maintenance. Which instruction should a nurse provide to a post-menopausal woman to promote bone health? So we talk about bone health here, and it's health promotion and maintenance. Avoid weight-bearing exercise. Limit sun exposure to prevent skin damage. Increase calcium and vitamin D intake. Use corticosteroids regularly. Correct answer is C. Increase calcium and vitamin D intake because calcium and vitamin D are essential for bone health. Weight-bearing exercise and sunlight also help to maintain bone density, but supplements are directly necessary. Question 3, NCLEX domain, psychosocial adaptation. A nurse assesses a patient with a recent femur fracture. Which findings requires immediate intervention? Mild bruising near the fracture site, pain rated 6 from 10, respiratory rate 28 and petechiae on chest, swelling in the injured limb. Correct answer is C. Respiratory rate of 28 and petechiae on the chest, because those are the signs of fat embolism syndrome, a serious complication after long bone fracture. It requires immediate intervention. Question 4. NCLEX domain, pharmacological and parental therapies. Which medication teaching should a nurse provide to a patient prescribed alendronate for osteoporosis? A. Take at bedtime with glass of milk. Lay down after taking it to avoid dizziness. C. Take with a full glass of water on empty stomach. D. Avoid any fluids with this medication. So correct answer is C. Take with a full glass of water on empty stomach because alendronate can cause esophagitis. So it's an inflammation. It is inflammation, and eso is esophag. It should be taken with water and patient must remain upright for at least 30 minutes. Question 5, NCLEX domain, reduction of risk potential. A nurse is performing a neurovascular assessment on a patient in a long leg cast, which findings requires immediate attention? A. Cool toes and delay capillary refill. B. Swelling around the chest. C. Reports of mild itching. Pain related 4 out of 10 with movement. So it's reduction in risk potential. So a nurse is performing a neurovascular assessment. So when you do this assessment, what do you think first that it's very important? So correct answer is A, cool toes and delay capillary refill, because cold, cool extremities and delay capillary refill may indicate impaired perfusion or compartment syndrome and require immediate intervention. Question 6. NCLEX domain, safety and infection control. A nurse is preparing to assess with the care of a patient undergoing a bone biopsy. What is the priority nursing action immediately after the procedure? Bone biopsy. So this is a diagnostic that the patient will do, and a nurse will assist the patient and what the nurse should do immediately after this procedure. A. Encourage early ambulation. Yeah, just go, make a marathon. Apply ice packs to the biopsy site. Sure, give more pain there and decrease more. Monitor the site for bleeding. D. Administer analgesics before the procedure. So correct answer is monitor the site for bleeding, because monitoring for bleeding is essential for after the bone biopsy due to vascularity of bone tissue. Immediate post-procedure bleeding can lead to complication if not addressed. And analgesic, this is not this you should do, but here says before procedure. We talk about after the procedure. So this kind of makes you to think, oh, of course I need to give for pain. So here it's painful that a candidate, when take a test, sees the first word and the second and click this and move to the next one, because it's so convinced that to give pain relief for because the patient might have some pain. But here it says action immediately after the procedure. So it's just like, oh my goodness, I have to give. But usually you give before, but here it says after. So you see those little words, how can make you to rush into a question and answer and you move to the next. Just take your time. With my LVN NCLEX, I stood to one question for 10 minutes. I just looked there. I thought like this computer might shut down because I don't move to the next question. Oh my goodness. I hear you, the stress. Question 7, NCLEX domain, psychosocial adaptation. Which finding should the nurse report immediately after assessing a patient with suspected compartment syndrome? Okay, so which findings? You have to say that you suspect this to the doctor. A, pallor into the extremities, pain that increased dispute medication, swelling near the injury site, limited active range of motion. So the answer should be pain that increase dispute medication. That's correct. Unrevealed pain is the most significant early sign of compartment syndrome, indicating rising pressure that can compromise circulation and nerve function. Question 8. So we have 16. Now we are on question 8. NCLEX domain pharmacological and parental therapies. A patient with osteoporosis is prescribed alendronate. Which instructions should the nurse provide? Take the medication with milk before bed. Sit up right for at least 30 minutes after taking. Chew the tablet for faster absorption. D. Take with calcium and vitamin D supplements simultaneously. Sit upright for at least 30 minutes after taking it. So this question, it's kind of repetitive with the previous one, but it's a little bit different. So I made it in purpose because this might be how a question can be similar, can be so identically, but a little bit different. So keep in mind that many questions that even we work on hypothetically, how they have similarities between them. So for taking the alendronate for osteoporosis, sit upright for at least 30 minutes after taking it. Because cause esophageal irritation or ulceration. Remaining upright helps prevent this adverse effect and promotes drug delivery to the stomach. Next question. NCLEX domain reduction of risk potential. The nurse is assessing a patient who recently had a total knee replacement. Which assessment finding is most concerning? Mild bruising around the surgical site, redness and warmth at the incision, decreased dorsalis pedis pulse, D. Pain rated as 5 out of 10 with movement. Correct answer is decreased dorsalis pedis pulse because a diminished pulse in the affected limb may indicate compromised circulation or a potential thromboembolic event requiring immediate intervention. So you might feel like on these three, but we need to look for pulse. Take my light away. Question 10. Today my throat hurts. Domain health promotion and maintenance. Which health promotion teaching is most important for post menopausal women at risk for osteoporosis. Engage in a low impact exercise only. Increase intake of vitamin C. Take calcium and vitamin D supplements daily. Avoid sunlight to prevent skin cancer. So it's a repetitive question. Adequate calcium and vitamin D intake helps prevent bone demineralization, especially in postmenopausal women who are at risk for osteoporosis. Hormonal influences. Um, Question 11. Musculoskeletal assessment. It's about gait, psychosocial adaptation. A nurse is observing a patient's normal gait. Which finding would the nurse document as characteristic of a normal gait? The base is narrower than the patient's shoulder width. Foot placement is inaccurate with a shuffled movement. The patient demonstrates a symmetrical arm swing. The stance phase accounts for only 40% of a walking cycle. Correct answer is the patient demonstrates a symmetrical arm swing. A normal gait is characterized by a base as wide as patient's shoulder width, accurate foot placement, a smooth and even walk, and a symmetrical arm swing. The stance phase, foot on the ground, is approximately 60% of the cycle. Diagnostic test, the DEXA scan reduction of risk potential. A 65-year-old postmenopausal patient is scheduled for a dual energy X-ray absorptiometry DEXA scan. What is the primary reason the nurse anticipates these tests being ordered? To rule out the presence of a fracture that is not visible on X-ray, to measure the angles of joint mobility using a gonimeter, C, to identify the bone mineral density and assess for osteoporosis, to determine the presence of a meniscal or ligamentous tear in the knee. Correct answer is to identify the bone mineral density and assess for osteoporosis. So this dual energy X-ray absorptiometry DEXA scan assess bone mineral density. And is the most common test used to identify osteoporosis and an increased fracture risk. X-ray confirms fractures, MRIs or arthrograms identify soft tissue, ligament, meniscus tears. Gonimeters measure joint range of motion. So, nursing implication, contrast type, pharmacological and parental therapies. A patient is scheduled for a CT scan, computer tomography scan with an IV contrast. Which nursing intervention is essential before the procedure. A. Verify the patient has a family member available to drive them home after the test. Assess the patient for a pacemaker or surgically implant metal clips. Think what procedure it's only for pacemaker or metal clips. Verify whether the patient is currently taking metformin. Instruct the patient to refrain from applying lotion to the skin before the test. It's pharmacological, so we have to make sure for pharmacological actually it's medication. So verify whatever the patient is currently metformin. Contrast diets nephrotoxic and can increase metformin levels, increasing the risk for lactic acidosis. Metformin should be yelled before the procedure and for 48 hours after. Driving a patient home is necessary after sedation. Assessing for metal is necessary for MRI. Avoiding lotion is for an EMG. So you see, like these are correct, but for different tests. So for CT scan, this is correct. This is for different scan. This is for different scan. So it's basic care and comfort. A nurse is providing a discharge instruction to a patient who just underwent an arthrocentesis on the knee. So you provide discharge to a patient that just had arthrocentesis on the knee. Which instruction is appropriate to manage pain and swallowing at the site? So what instruction you will give? Place a warm pack on the knee for 20 minutes every 2 hours. Perform full of range of motion. Exercise on the knee, on the joint 3 times a day. Apply ice to the wound for the first 24 hours using a towel barrier. Ambulate without assistive devices to increase joint circulation. So the correct answer is apply ice to the wound for the first 24 hours using a towel barrier. So post-procedures instruction for an arthrocentesis include the application of the ice to the wound for the first 24 hours to reduce the pain and swallowing. Using a towel or a cloth to prevent frozen tissue injury. Warm packs are inappropriate for acute swallowing. Full range of motion is not advised immediately after the procedure, and to ambulate without assisted devices also not. A patient might need. So next. Safe patient positioning, immobility, patient management of care. The nurse is planning care for an immobile patient to prevent musculoskeletal related complication. Which intervention is a priority? Maintaining the patient's body alignment at all times, repositioning the patient every 2 hours, encouraging the patient to cough and deep breathe every 4 hours, administering pain medication 30 minutes before physical therapy. Correct answer is repositioning the patient every 2 hours. The evidence-based practice section of the chapter emphasizes that repositioning the patient every 2 hours is essential to prevent immobility related injury, specifically to prevent skin breakdown over bony prominences and to allow adequate lung expansion. The other options are important but not the primary. Over achieving management strategy to avoid immobility complication across system. So just if you have the Davies Medical Surgical Nursing edition 3, because this is the book I'm using, go to chapter 52 and read more about evidence-based practice, that section, and also the red safety alert from each book, and mostly nursing management. There also they talk about to do and not to do, and there they have the actions, evaluate outcome. They talk, so it's about 2 pages. Will be, I think that can be read easily, quickly, and you can just make your own questions like this, or that will help you to understand what goes in when you select the question. Because some questions that are really tricky. Even if you read and you memorize like a papagal, we say papagal, in the question, it's so tricky and you need to use your critical thinking. Now we go to the last question. This is the last question, and it's electoral apply. This I said my 16th question. So they have more on NCLEX domain. So I didn't put nothing yet, and this can be an example that a candidate might have. So patient is discharged after undergoing an arthrocentesis on their left knee. Which discharge instruction should the nurse provide? Select all that apply. A. Limited activity on the affected knee for the next 12 to 24 hours. So think, what NCLEX domain is this? Limit activity on the affected knee for the next 12 to 24 hours. Is this what gives you? So think about, is this correct or not? And yes, why you think that? So you need to have like so I think this is like more like a comfort and limiting activity, kind of rest. So B, use a warm pack on the knee for 20 minutes every 4 hours to promote healing. So what is this? It's correct or not? and what NCLEX domain is. So I think gives like a comfort, something like that, right? Report any signs. Take my flashlight away. See, report any signs of fever or redness and warmth at the joint site. So is this correct? Yes or not? And what NCLEX domain should be this? D. Apply ice to the knee for the first 24 hours to reduce swelling. Is this correct? Why? What NCLEX domain could be? E. Take prescribed aspirin or anticoagulants to manage pain and inflammation. Is this correct? Yes or not? And what NCLEX domain is? Let's see. F. Evaluate the leg periodically to reduce edema. Is this correct or not? And so I give you, this is correct, this is correct, this is correct. So limit activity on the affected knee for the next 12 to 24 hours is correct. And includes in basic care and comfort. Here these are the two: reduction of risk potential and basic care and comfort. So here this question has 4, and if a candidate answered just 3 and not these, so this is basic care and comfort. So if you a student will not make these, let's say, or maybe A, which is also basic care and comfort, then it gives you below 4 basic care and comfort. So here is the tricky that might make a student to miss one of the NCLEX domains. So I will explain one by one right now. Here you see the option A, B, C, D, E, F. A, it's yes, it's basic care and comfort. So limiting rest is a standard post or procedure instruction for arthrocentesis to promote healing and reduce irritation to the joint. B, it's incorrect. The warm packs are inappropriate for immediate post procedure care, as they increase blood flow and can exacerbate swelling and pain. Ice should be used. Ice because ice decrease the circulation and warm will increase it. So for this we want to constrict. C, it's a reduction of risk potential. So signs of fever, redness, or warm indicate a potential infection, septic joint, a serious complication of a joint puncture. The patient must report those immediately to prevent joint destruction. D, we said that it's basic care and comfort. Applying ice is essential for the first 24 hours to cause vasoconstriction, which helps reduce the swelling and pain, as noted as the chapter's arthrocentesis section. You go there and you can read. On the E, it's not, even kinda sounds like reduction of risk potential. The patient are instructed to avoid aspirin or anticoagulants. pre and post procedure, because those medication increase the risk of bleeding into the joint space, hemarthrosis, which is a risk reduction priority. Last one is correct because it's in basic care and comfort. NCLEX domain, basic care and comfort is correct because elevation is a non-pharmacological, and NCLEX and insurance purposes, they encourage non-pharmacological comfort measures as many as possible. That uses gravity to promote venous return and lymphatic drainage, thereby reducing edema and pain. Here I end this video. Thank you for being with me until for 1 hour. Thank you, and I hope this was helpful, and if not, just give me an insight how can I improve myself. Thank you, and I will see you in the next chapter.
We finally made it! Thank you again for your time and trust. I'm Mia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.